For topic 3, I chose integrative health. We did a yoga nidra exercise in week 7 and it really stood out to me. It reminded me of being at the Nordic spa, the calming tones, the warmth, the sense of total stillness. I haven't been able to go to a Nordic spa in a long time because they are expensive, but that exercise brought me right back to feeling like I was at one. I also realized that I already do use a lot of integrative health in my own life without knowing it really had a name. Things like drinking tea, lighting candles, or choosing calm environments. Learning that these are actually evidence-informed approaches to health made this topic feel personal and meaningful. In our Week 7 reading, Estel et al. Defines integrative health as an approach to care that combines conventional Western medicine with evidence-informed complementary practices to support the whole person, mind, body, and spirit, and social well-being, while focusing on prevention, balance, and the body's natural healing abilities. So a key piece of information I didn't really think about was talked about in the Metin and Gulabar 2021 article. The article talks about how a number of patients do use complementary practices at the advice of family or friends, and that they do lower their stress levels and improve their quality of life. However, the issue can be that many times that they don't report these things to their care providers, and not reporting can lead to a risk of things like herbal medicines or another complementary health practice just interfering with their drugs for their care. And as a nurse, it's important for us to provide a safe environment so that our patients do feel comfortable in telling us their personal health practices, and then we do keep a level of knowledge of these sort of things like medicinal medications so that we can inform our patients that they may interfere with their drugs, and just so we can educate our patient properly. And on that point, the Austin et al. 2021 article also emphasizes that documentation is central to the continuity of care and interprofessional communication. Historically, nurses have always been responsible for documenting the full picture of patient assessments and interventions, but they suggest that integrative therapies are often missing from the electronic health records, and that the gap is for several reasons. Patients don't always report their use of complementary therapies, providers sometimes don't even ask, and that the electronic health record systems themselves don't always support these sort of entries. They just might not exist. And then Austin et al. 2021 also argues that without accurate documentation, important clinical information is lost, and opportunities for better evidence-informed care is just missed. Integrative health connects to several of the 6 pillars of health. Stress management, sleep, and social connections are some that I can connect to it. By practicing them myself, I will be able to regulate my own stress and help myself sleep better, and perhaps build social connections through activities such as yoga. And then professionally, being cognizant of different approaches reminds me of their importance for my future patients. I hope to be able to ask my patients about the things they're using, and just be able to respect their autonomy and choice so that I can provide them with patient-centered care. A lingering question I'm still curious about is how nurses can realistically integrate calming or holistic strategies into environments that are hectic, overstimulating, or short-staffed. I also wonder how we can stay informed about complementary therapies without becoming overwhelmed ourselves. This topic helped me to realize that many of the strategies that I use to support my own well-being are actually evidence-informed. It also showed me that integrative health can be a bridge between who I am as a person and who I'm becoming as a nurse. Someone who values the whole person, cares and respects their patient's autonomy, and understands the importance of balance and calm in the healing process.